How do you respond when a patient refuses occupational therapy? I've seen a lot of different reactions. Some therapists might say things like, if you don't participate, you'll just get weaker, or something like, your insurance won't cover your stay here if you don't participate. What are your thoughts on that? What do you think? They're not wrong, but how we say these things matters. The message can still be truthful and therapeutic if it's delivered with empathy and intention. We can tell the truth without triggering fear or shame. And sometimes it just becomes a missed visit with no real chance to figure out what's behind the refusal. If you have ever felt stuck in these moments, I want to share a strategy that has worked for me time and time again. This is not in your OT textbooks, and you're not going to hear this in a sterile CEU course. Here's the key: you're going to do therapy without ever calling it therapy. You're going to lean into your therapeutic use of self and meet this person exactly where they are mentally and emotionally. Because truthfully, a lot of patients just want to feel heard. They want someone to listen, even if they are just venting. They want someone to see their humanity, not just their transfer level or whether they can remember the words apple, pen, tie, house, car. Yes, it's our job to assess those things, but how we deliver it matters. A little finesse goes a long way. Let's just say John Doe just transferred to your TCU. He might be a new evaluation or someone already on OT caseload. He hasn't had a shower in days, maybe even weeks, depending on how sick he was at the hospital. He's tired, he's disoriented, he hasn't had a good night's sleep in who knows how long. And now he's being told he has therapy today. That word, therapy, can feel like a threat. He's probably picturing resistant bands, hand weights, exertion. And what he really needs right now is restoration, a reset. So when I walk in and the patient says, no therapy today, whether they're not feeling well or mental health is playing a role, I don't respond with authority, and I never use threats. I meet them where they are, and from there, I build them up. I use validation and empathy to earn their trust. Now, this is just an example. This is not cookie cutter script. I just want to share how I control the situation. I would respond with something like, okay, no problem, no problem. We can take a break from therapy today. You're making them feel in control, right? You're letting them feel like they've got control of the situation. You got to let them know that you're human too. So, for example, I get it. I get it. I need a break too. I had two heavy baseball games last night. My kiddo was pitching. It was an intense game. Whatever conversation that you want to strike up to kind of disconnect you from that therapist status. So take this time to build a small connection. Do some small talk. And then, before I go, since I have a few minutes, would you like to freshen up a bit? I could help you sit on the edge of the bed and you can just get washed up. Just feel a little normal, feel a little human, feel a little more like yourself. Something like that. Just build them up. You can say something like, if you like, I can grab you some coffee or juice, something to help perk you up. We can just spend some time together and we can do something like this. Making them feel like you're being rebellious and you're not going down to the therapy room. And just like that, the walls start to come down. They're not bracing anymore. The guard drops. And now I have space to build rapport and gently reframe the session. So, depending on how things go, I might offer to transfer to the wheelchair or the recliner. And I always offer something in return to fuel their motivation for the transfer. I will say something like, I'll make your bed while you're getting washed up. So during this time, they have completed bed mobility, a sit to stand, a pivot transfer, and a functional task. It's about creating comfort, dignity, and a sense of partnership. If they don't already have grooming and hygiene supplies in their room, I'll create a self-care goodie basket using the supplies and the equipment that the facility already offers. Fill a new basin with some fresh washcloths, hand towels, fresh grippy socks, body wash, deodorant, a hairbrush, lotion, a box of Kleenex, and instantly it looks like a self-care basket you'd find at the spa. I set up the rolling table with a towel. I make it feel like a mini spa day, not treatment. Sometimes I'll even say, let me help you wash your back. because I know that hasn't been touched for days. And when I say patience melt in gratitude, I mean it. Here's where the OT magic happens. Here's what's really going on. I have gone undercover with clinical observation. Sitting balance, check. Core activation, yes. Task sequencing, range of motion, endurance, visual scanning, yep. Cognitive engagement, emotional regulation, safety awareness, all of it. Executive functioning and fine motor skills, coordination, absolutely. This is therapy. This is OT. You don't have to call it therapy. This is very functional and very real world living. And sometimes our biggest job is reminding people they are still human, that their dignity matters, that we see them. So next time you hear, no therapy today, I'm not feeling well, I'm not up for it, don't take it personally. Take it as an opportunity. Lean into your therapeutic use of self because OT isn't just about adaptive equipment and exercises. It's about restoring who people are. Let me know in the comments below how you turn refusals into therapy participation. Until then, stay safe and be well. Oh, and the sirens have to come on just now. That's perfect timing. Just when the wind was great and the sun was good and the lighting was good. All right, don't mind the sirens. We're going to wait until I don't live in an area where they're probably responding to a cat that's stuck in a tree. And my mic battery is draining. My kids are still sleeping. My husband's sleeping. I have to hurry up and film this because I have to make breakfast for them, or else they are going to become demonic and possessed. And then I have to perform an exorcism by making a very large, substantial breakfast for all four of my boys. And that is the cure to happiness and sanity.